Welcome to the second meeting of the APPG on the National Food Strategy. Today we'll be focusing on the obesity challenge and what the National Food Strategy can and should be recommending to help address that challenge.
As somebody who just about hit 10 years in the House of Lords, and I was a lone voice discussing obesity when I came in. So I mean, although it's a tragic reason that our nation are getting more obese and less healthy, I'm really pleased that there are more people taking an interest in it. So we'll kick off with our first speaker, with Professor Martin White from the Centre for Diet and Activity Research, CEDAR, at the MRC Epidemiology Unit at the University of Cambridge.
I'm going to offer some thoughts from my own particular perspective as a population health researcher. But as you know, this is a very complex problem that really demands interdisciplinary responses. But on this graph, I just want to draw your attention firstly to the very high prevalence of obesity in men and women. So it's running at about 67% in men and 60% in women currently. And that has gone up a little bit since the early 90s and has been high for a very long time. So what drives obesity? Obesity is a population problem. As you can see, it's pretty much endemic now. It's emerged over about 50 years. It results from system failures. Its main driver is what we call the obesogenic environment. So the abundance of low-cost, energy-dense foods, motorized transport, sedentary lifestyles, and so on. And together, these problems lead to a substantial excess energy intake at the population level. So this shows the price of different food groups in the Eat Well plate by 1,000 calories. I think the consequence of this should be fairly obvious to all of us. If you're living on a constrained budget and you have hungry mouths to feed, you're probably not going to spend your precious pounds on fruit and vegetables when you can provide the calories that your children need for much less. So I want to move on and talk a little bit about interventions. And I wanted to start by showing you this slide, which comes from a paper we published in 2016. And the point of this is to illustrate the different ways in which we can think about interventions and their importance for population health. You can see that at the bottom we have interventions like putting fluoride in tap water or putting folic acid in flour. So these are things that are delivered to whole populations, or indeed things like social marketing or nutritional labeling. Whereas at the top we have things like weight loss, drugs, and surgery or counseling. So things that would only be delivered to people with a particular problem. Now on the horizontal axis, we have another dimension, which is what we call agency. And this is defined as the extent to which an individual has to exert effort in order for an intervention to be successful. And you can see that for interventions like putting fluoride in water, nobody needs to make any effort. You just continue turning on the tap and the intervention is delivered. Whereas on the right-hand side, interventions like front-of-pack labeling require high levels of literacy and numeracy. A person would need then to interpret the information on the label, make a decision about what to do as a result of interpreting that information, change their diet, and so on. So that is quite a high agency intervention. It requires a lot of effort. So we recommended that interventions that are aimed at tackling population problems should focus on population interventions, and that in order to ensure interventions are effective and avoid widening inequalities, they should focus on low agency interventions. We analysed government strategies and policies for obesity in England between 1992 and 2020. We found there were 14 strategies published during this period that either covered obesity or explicitly on obesity. And within those, there were a little under 700 wide-ranging policies. The majority of these policies relied on individuals to make behaviour changes rather than shaping external factors. In other words, these were not, on the whole, low agency population interventions. What we did note is that there has been a change in the nature of policies over time within these strategies, so that the childhood obesity plan policies, which have been proposed between 2016 and 2020, do contain many more that are more structural interventions aimed at populations and are low agency. The example of tobacco control, I think, is highly relevant here. It's taken 40 or 50 years to really get on top of tobacco smoking and make a big difference. I think we can do that quicker with obesity, but we need to be incredibly smart about it. So the challenge is one of achieving greater alignment between the goals of the commercial food system and public health policy, which are quite a long way apart at the moment. But I think there is a little bit of hope, and I think there is some movement towards a system in which there is more profit to be made from healthier food.
Now it's my pleasure to introduce Sarah Hickey, who is Programme Director of Childhood Obesity at what used to be Guy's and Thomas's charity, but now Impact on Urban Health. And she's going to give us an overview on how they tackle obesity in Lambeth and Southwark.
So the rates of child obesity in Lambeth and Southwark are particularly high. So they're higher than the average rate in London. That's higher than the average national rate. Your chances of being obese or overweight are strongly linked to income. So if you're a child growing up in the neighbourhoods of lowest average income, your chances of growing up overweight or obese are over twice as large as those children growing up in the wealthier areas. Unless you crack that link, you're not going to crack the big issue. Everything we do is about looking at the spaces where children and families spend their time, so their homes, their schools, their high streets, and reconfiguring those spaces so that the food options within them, the food options that are available, that are promoted, that are most accessible are the healthier ones. Both through our formal ethnographic research and just spending time with families through our project, I guess what comes out time and again is that public health messaging around what a healthy diet is has actually been successful, and parents know those, and parents on the whole will say, I care very much about the health as well as the happiness of my child. However, I'm trying to solve for a number of things when I'm making food choices. Those other things are price, because I'm constrained by my budget. So any food option absolutely has to be affordable. And the second is convenience. So I have time constraints because of work, childcare. The food has to fit within those, and then linked to price, taste. So I don't want this food to go to waste. I want my children to eat it. And when you step out with them into the high street, your local food retail environments, what you are flooded with is many, many options that are very cheap, convenient and tasty, but also unhealthy, and many fewer that are cheap, convenient, tasty and healthy. Most people, regardless of income, education, will say that this is an issue about education and willpower. And I think that pens a barrier to solutions, because it drives a lot of energy away from some of the big changes that are needed. One of the biggest determinants of food and diet are commercial. So nearly 80% of people's food budget is spent in supermarkets, and the products that are sold there, the way they are placed, promoted, priced, really drives people's baskets and ultimately our diets.
And Stefano Agostini is chair of the Food and Drink Sector Council's working group on the National Food Strategy and CEO of Nestlé UK and Ireland.
I think that the industry can make, let's say, a good job in the future, can be more proactive. And us as Nestlé, we want to market better in terms of information. We want to keep investing on innovation and reformulation of our product. But we need to work holistically. It means that we need to work together because it's a very complex matter. We really think that food is something that people have to enjoy, but we need to promote more education about the ingredient, how to buy, how to shop, how to make your good product to eat along the days, but in a balanced way, because we think that a good life means also to enjoy some indulgence, to enjoy some pleasure.
Could I now ask Caroline Cerny, who is the Alliance lead at the Obesity Health Alliance, to do some introductory remarks.
So the OHA is a coalition of health charities and medical royal colleges, and we campaign for population level structural policies that create a healthier environment. So I think Martin made some really valuable points for the food strategy team to take on board, particularly thinking about how the food system adjusts, how it will course correct around policy, and this would certainly like to see some concrete policy recommendations that anticipate industry effect. Any action to reduce obesity needs to be considered as part of a comprehensive whole system approach that focuses on many different areas. There's not one policy area or one single policy that is going to be our silver bullet.
There are a couple of questions around about processed foods.
The evidence on ultra-processed foods is emerging and accumulating quite rapidly now. The evidence is looking quite strong in terms of a causal relationship between ultra-processed foods and adverse health outcomes. The problem we have is that, of course, there is so much ultra-processed food in the food system currently. So, if you go into a supermarket, so much of it would fit into the category of ultra-processed. So we've got an immediate problem. And I think we would have to deal with it in a kind of incremental way.
In UK, we have brought to a level of too high level in terms of convenience. It means that on one side, we want to give to the consumer, to people, the opportunity to have ready-to-eat food, ready-to-cook food, very accessible, a different size. So we need also to educate in terms of what does it mean good food and how you have to prepare your food. Because it's not only ready to eat, ready to drink, or to all these things that can be a solution of the future.
Is there any country or any area that does this well, or is this an international, is this a global problem that we are fighting a losing battle with?
I mean, yes, it is a global problem, and unfortunately, it's a global problem that's getting worse. So, growth of obesity in lower middle income countries is very rapid in some cases. Yeah. There are some isolated examples of good practice. And I think on food labeling and regulation of sugar, Chile is looking interesting. Mexico obviously has a sugar tax and a wider range of measures as well. I think the problem we have at the moment is that we don't have solid outcome data to tell us whether or not these have been effective in terms of reducing obesity.
To what extent is tackling obesity an individual responsibility?
I think that the problem of obesity is so large, in population terms and in terms of how endemic it is, that there's no way that we can crack it one person at a time. Educational approaches are rather weak in terms of their effectiveness.
We all have the best intentions for our own diets, and they're very, very hard to sustain in the face of lots of messaging incentives to do the opposite.
We do have a prevailing rather unhealthy food culture in the UK. I think we need to think quite carefully about that and how that might be addressed as part of an overall package. But I think it's a really tough nut to crack, actually.
This is a matter of education. So, but it's difficult. It's difficult how to support those families that is not a culture of food.
I'd just like to challenge that point that the problem is education in more disadvantaged communities. Parents from lower income households, just the same as those from higher incomes, do get the principles of a healthy diet. What the problem is the food options that are available to them and how they meet or don't meet those.
So there's a question from Dan. What do we all think? What do you think that the National Food Strategy Part 2 should propose to urgently address the UK's cheap food culture, which is surely at the heart of this?
I mean, I think the broad point that the strategy needs to address is that it's a kind of an uncomfortable truth that we find ourselves in, that a food industry that thrives on making millions of pounds from ultimately producing highly processed, highly calorific, sugary food and marketing it to us heavily is not compatible with a healthy population. I think we need to build on policies that have worked in this area. So the fiscal policy we have got that is starting to work is the soft drinks industry levy. I think there's plenty of scope for that mechanism to be applied to different categories of food, which would ultimately make industry bear the cost for the food that they're producing.
Our food is artificially cheap. We know that in a system-wide sense. If we're going to move towards a situation where food is more realistically priced in relation to its actual cost to produce, then we need to provide a kind of economic environment in which people can afford that food in a more equitable way.
Miles Bremner asked a question about good food education in schools and a consistent wider healthy school environment. I mean, I know we're supposed to teach cooking in schools, but I'm not aware that it actually happens.
Can I pick up on that, Anne? So
yeah,
I had a discussion with the schools minister recently to find out exactly about that. There isn't really a clear guidance to schools as to what should be covered. You know, I think that's a really interesting opportunity for us to pull together both nutrition and cooking skills, because it should be one thing, shouldn't it? The knowledge about why it's important, and then the knowledge of how to prepare it.
I do think that we need to take a kind of whole school approach to this, think about how we create healthy schools with regard to diet, physical activity, and so on. And in relation to school food, ensure that the requirements, national requirements, are being met so that kids are learning in an environment where there is healthy food.
Yeah, and I see that Sharon Hodgson, who's an officer of this group, says that cooking is clearly covered in the school food plan, which schools are supposed to follow. And Henry Dimbleby obviously was the author of the school food plan, so I kind of think it's there. I just don't think it's happening.
I mean, I think we've had a really comprehensive discussion. So thank you very much, and have a good rest of your day.